What is the most low-risk natural procedure for chronic under-eye bags? I've had under-eye bags since I was a child, and have always been self-conscious about them. I know it's hereditary as my mother had the same issue. I'm only 23 years old, and I feel as if I shouldn't be dealing with this so early in life. Picture is me without any makeup, slightly smiling.
Thank you for your question. You're asking about what's the most natural, low-risk way to reduce your chronic under-eye bags, and that you've submitted a photo that shows the bags, and yet you're age 23 and you feel you're too young to be dealing with this. Well, as a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years, I can tell you that it is a reality that there are many people your age and younger who have under-eye bags. There's an assumption that under-eye bags is associated with aging, and certainly there is a certain degree of truth to that. As we get older, soft tissue changes occur, but a lot of it is genetics, and the genetics of under-eye bags can affect someone as early as their teen years. Our youngest patient we ever treated for under-eye bags was actually 14 years old. So with the 14-year-old patient, this was a problem because he was being embarrassed in school and was being teased for allegedly being on drugs. So it has a certain tremendous impact depending on your environment and what you do. So you're asking about low risk and natural. When we look at the photo from just a forward view and a two-dimensional view, it isn't exact for us to be able to tell the level of protrusion of the puffiness. First of all, what is the puffiness? The puffiness represents something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around the eyes will push forward and create this bulge or hernia. That's why we call it herniated fat. When you do your research, you'll learn about certain approaches that include the use of fillers to try to soften and camouflage the projection of the fat pockets. Now, this can be an option that will be acceptable as a patch for short term. It is technically natural because it's hyaluronic acid, which is a natural part of your body. But at the same time, it's dependent on how much projection there is, how forward the puffiness is. What we do is we evaluate you to see how much projection of the fat pocket there is. This means that if it's bulging beyond a certain level, placing filler underneath that to try to camouflage can also make the eyes look even puffier. As far as the option then is to do a procedure called a blepharoplasty. Typically for a younger person, we do something called a transconjunctival blepharoplasty. This is a procedure where we address these fat pockets from behind the eyelid, and we're able to reduce, sculpt, reposition, whatever is necessary to create a nice contour so that it looks as if you never had the bags. In terms of risk, everything is relative. Anytime you do any type of procedure, whether it's an injectable or surgery, there's relative risk. If you look in the literature, and you'll find that even injectables can cause problems such as skin necrosis, which means killing of the skin, or blindness, which are pretty scary risks. So from my perspective, as a specialist, as an expert who's been doing this for over 20 years, these risks can be minimized by you choosing a doctor who has a lot of experience, and you look at what are the things that are the risks for anything you do. The lowest risk thing to do is nothing, but since it's bothering you, you need to do something. So as I mentioned, for us in our practice, it's a threshold question. If it's very slight in terms of its projection and a patient is really just doesn't want to do anything surgical, we can do a combination of filler, or we also do a combination of filler and platelet-rich plasma for people who also want to improve skin quality. Platelet-rich plasma is derived from your own blood and helps improve the quality of the skin. But at 23, I'm not sure if that's as critical, but that would require a physical exam to make that determination. But if your puffiness is really that significant and you don't want to do fillers every few months, then it's highly likely you'll probably be better off doing a transconjunctival blepharoplasty. When we do this procedure, we do this in our practice, in our office operating facilities, which are certified by the Joint Commission with the same people who certify hospitals. So we do this under local anesthesia with light intravenous sedation. This means you're relaxed, but you're not under general anesthesia. Our patients are comfortable. They're in a familiar surrounding with a lot of friendly faces. They know, from our front desk staff to patient coordinators and nurses and technicians. So it's different than walking into a hospital or a surgery center. We've actually created this on purpose because this is one of the great concerns for people who are afraid of doing surgery. So with that being said, you might be, your best option at this point is to move forward and actually meet with doctors. Meet with qualified, experienced cosmetic surgeons who do a lot of lower eyelid surgery. And see if you're comfortable with what their recommendations are. You may want to get more than a few opinions, but understanding that every doctor has their own approach, you might find yourself overwhelmed with a lot of different recommendations. So you kind of have to use your own judgment and your comfort level as to the doctor you feel most comfortable with. So with that being said, I hope that was helpful. I wish you the best of luck, and thank you for your question.